Hello everybody and welcome to this month's video message. Well, this morning I'm here in Clinic 5 on St Peter's site with Linda Edwards, who is our Mouth Care Matters lead. Good morning, Linda.
Good morning.
How are you this morning?
I'm very well, thank you.
So Linda, I've been hearing a lot about Mouth Care Matters and I've got a limited understanding of what it's all about. What is Mouth Care Matters?
Mouth Care Matters is a health education Kent, Surrey and Sussex initiative.
Okay.
Mouth Care Matters has been rolled out across acute trusts, and the aim of the programme is to upskill staff and provide them with the information, the knowledge that they need to provide good mouth care for patients, and that's provided through training and education.
If we don't pay attention to oral hygiene and support patients with that, what can be the detrimental impacts?
Well, we are aware that there is a link between poor mouth care and other systemic diseases.
Okay.
And the one that we get concerned about is hospital-acquired pneumonia.
Okay.
Because we know that the bacteria in the mouth can act as a conduit for the microorganisms that cause pneumonia. Hospital-acquired pneumonia can increase a patient's stay by about 8 days. In addition to that, we know that if a patient is feeling uncomfortable or unhappy, that is going to be detrimental to their well-being.
Yes.
And if you've got a dry mouth or you've got a dirty mouth, then that can really make a patient feel quite uncomfortable.
I think that's a really important point for us to pick up in this conversation, because one of the things that I'm really keen on with everybody, I think we're all keen on this, is avoiding harm for patients in the hospital for all the reasons that you've described around extending patients' stay in the hospital. And clearly, if this helps with promoting good recovery, comfort and reducing stay in hospital, that sounds like a really good thing to be pursuing.
Yes, and there's evidence to show that patients who have a dry mouth or an unclean mouth do not want to eat or drink. So that is a very important aspect of their recovery.
So another important contributory factor here is supporting patients have adequate hydration and nutrition in order to be well and to recover from an illness. And clearly, if your mouth is sore or ulcerated, then that I guess you don't want to eat, is what you're saying.
That's correct, yes.
So Linda, I understand that you've been out in the wards, observing care, looking at practice and also looking at care records to see how well we're providing and recording this care. Tell me what you found.
I went through a number of patients' records and found on a very few that mouth care had been provided, but it didn't actually state what mouth care meant. I just found the word toothbrush mentioned twice, and so there were quite a few records where it would appear that mouth care had not been recorded or not given.
And in terms of actual practice, what have you seen?
I've seen pink sponges used a lot as a method for cleaning mouths. Pink foam sponges are not designed to clean mouths. Pink foam sponges are designed to take a small amount of moisture to the patient's mouth. So in other words, for patient comfort, but not to be used as a cleaning tool. And I have seen or been told that a pink foam sponge has been used with toothpaste on it to clean teeth.
Really?
And
goodness me. So you heard it here. Toothbrushes are what we use to clean patients' teeth and mouth, or help them clean their teeth and mouth. We do not use pink foam sponges for mouth cleaning at all, ever. That's not what they're for. I can't end this segment of our film without asking, have you seen, please say yes, Linda, you've seen some good practice?
Absolutely, I have.
Oh, that's such relief.
I have come across some very passionate people who have been a joy to work with.
Oh, that's great.
So there's a lot of really dedicated, passionate staff members out there, and I've really enjoyed working with them.
Oh, that's brilliant. I know that's true. I meet them myself every day, and it's really good to hear that you've had some time with them too. So, messages, therefore, team, there's a big message there about the pink sponges, and I'm certainly going to take a conversation away around that, Linda. Please record the good care you're giving, because actually if you are giving that good care and it isn't recorded, the inspectors will assume you're not giving it, and that's such a shame not to have that good work recorded and valued in the proper way. So please think about that. And of course, as Linda has said, if you need help with any of this or you want to learn more with your team, please make contact with Linda.
Yes, thank you.